Alternative Care Framework is the official advocacy of care for responses to vulnerable children in Uganda. The framework intends to ensure that children are entitled to the enjoyment of parental care and protection and shall, whenever possible, have the right to reside with their parents.
The Alternative Care Framework was set up to ensure that we were not placing children in care that would be damaging and dangerous to them. We know that it's very difficult for families. As a father myself, I can tell you that it was a struggle. When I had my first child, I needed the support and the network of others. So we know that parents struggle. In Uganda, obviously, for various reasons. There's access to education, there's poverty, and so they give up their children. So we know that children will be abandoned. We know that children will be abused by some families. So the framework was developed to support those children.
With the Alternative Care Framework, the government of Uganda has positively responded to a set of official standards and processes to be used when responding to the plight of orphaned and vulnerable children.
Government of Uganda has had a lot of structures created. It's just that the resourcing of those structures is very difficult. So we don't have enough technical know-how. We don't have enough people who can run and do this work. We need more training. We also don't have enough money. So what we're doing with the government is coming alongside them, offering them what we have in our budget to support their resourcing, but also training government staff, probation, social welfare officers, community development officers, village health teams, child protection committees across the network of the areas we work in. We're training to build their capacity and technical know-how of supporting the prevention of children going into institutional care.
Today, Uganda has more than 800 orphanages. However, the Alternative Care Framework emphasizes that institutional care is not the best for children.
The orphanages cannot provide the right environment for the growth of these children. We also think that there are other options that can be very useful for our children, even if they are missing their parents, or they are missing their families, and they have nowhere else to stay. So the framework actually provides a continuum of care that can be able to cater for these children, and will stop them from being in an institution for such a long time. We have done research before, when I was still working in the ministry. We now know that 80% of the children in the children's homes are actually children that have got relatives, that have got parents, some of them, and have got people that can look after them within their own families. And we feel that it is very wrong for them to be transplanted from families and taken to an institution, which institutions do not provide proper care and upbringing for them.
Before one thinks of taking a child to an orphanage, they should use the options which are readily available.
The same framework outlines various care options for children once any child has been deprived of parental care or biological family care. There are options such as kinship care within the wider family. There are options such as reunification to a family member. There are options such as informal foster care, placing a child with a known family member. There are options such as foster care. Once this child has been disrupted from their normal family setting, another family can take up the care of this child, that is under foster care and adoption. So there are many other options as opposed to placing them permanently in the orphanages or the children's homes.
The Alternative Care Initiative is ensuring that communities are engaged in the framework implementation program by working with strong social workers across Uganda.
We are reunifying the children back into their families. We believe children are better placed in their families, and 80% of these children actually do have families. We have reunified over 15 children so far, and we want and are working towards ensuring Smile Africa transforms into a community center, a community hub, where community-driven services are available to the people. Many of the children actually who have gone home over the last 7 months are actually happy. They are thriving, and we are monitoring, supporting the families to ensure that these placements are actually very successful.
According to the framework, the more a child stays in an orphanage, their development stagnates. Media is therefore more effective for creating awareness about the framework and explaining to the public about the dangers of orphanages.
One of the biggest communication tools for better health, for advocacy, for information is media. For example, radio. Now, what we've found has been very useful for us is getting the story out onto these media channels. It's telling the guys deep in the rural area that, if you foster a child, you give them a better chance. It's ensuring that the right stories are told.
The media has played quite some role. Some stories have been reported, but I think we can do more in reporting on children issues, alternative care, especially investigating orphanages, investigating other institutions dealing with children, and bring out these issues, and especially promoting the whole notion of family care for children, that all children should grow in families. Many times when people identify and cared for children, they want to take them to police, they want to take them to orphanages. But I think the media can do much more to encourage families and communities to cater for these children.
The Alternative Care Initiative has organized workshops to expand partnerships with journalists in order to explore more issues on alternative care framework for the better future of children.
In regards to reporting, I've known where to focus my energies. I've now gotten a passion on what to follow up on. News stories do not have to come to us to the desk. We can actually go and look for them. So now our eye has been opened to looking at these different situations, looking at different home settings. What happens when you pick a child? Instinct, before I got to know the different options, was to go to a police officer because I did not want trouble. But guess what? Police will also tell you stay with the child. Or it's not even the best solution. You don't want your own child to be taken up by police. So this, in terms of reporting, has guided my language, my choice of words, my diction, broadened my vocabulary, deep understanding of what I'm talking about, and I'll be speaking from a more informed point of view.
However, Alternative Care Initiative is facing challenges while promoting national fostering and adoption among other alternative care options for children.
We do find challenges in engaging orphanages that are resistant, but one of the most important things is to help them understand the story. Now, how have we done that? We've taken children and young people who have grown up in care, and they've told their story. And you know what they've said? They've said things like, the people who looked after us didn't care about us. We struggled. We missed our parents. We didn't get everything we needed, and so much more. So we do face resistance, but I'm sure that with time, that resistance will change.
And in 5 to 10 years, the Alternative Care Framework will have installed policies that protect children's rights in Uganda.
I believe that in the next 10 to 20 years, our government will believe that orphanages are not places where children grow up. There will be policy that says no child in this country can grow up in an orphanage. There will be policy on foster care. There will be funding for foster care. There will be training for foster care. There will be better training for social work. There will be better training for community work. The advocacy in 10 years will be so amazing. It will have done its job.